I'm tired. In 2023, we did 2,000 prescription refills by phone sent in by the pharmacist. 2024, we did 1,000 of them. Now, that's a lot of work, and we have to decide how best to manage medications. We did a study very early on that in people who call in for prescription renewals or the pharmacist calls on your behalf, 80% of people are not taking the right medication to the right doses. So their blood pressure may not be properly controlled, their cholesterol may not be properly controlled. You probably don't even know what you're taking potentially. So we have to change that. I care about your health, and you should care about your own. And so the biggest reason why we get these repeat prescription renewals by the pharmacist is that we sent them off already. I want to do your prescription renewals when I see you face to face, and that we know exactly what you're taking. I want to give you the right medications. So I give 100 days, 3 repeats. So you have enough for 400 days. So I want you as so-called patient as being in part of your healthcare team. When I hear statements, the pharmacy will do it. Well, the pharmacy gets it wrong a lot. Things get changed. You get it wrong. I get it wrong. So we're going to have to decide whether or not I'm going to do your prescription renewals. I'd like to do them in person. And you're going to see some of our team members call you up and see if we can figure out a better strategy. We're going to bring some of you in. So every time you see me, is bring in your pill bottles. And people say things haven't changed. Well, a lot of mistakes are being made, and your health is too important. I want to do all your prescription renewals, all your medications when I see you. I see your file, your chart. It's the ideal time. And then we decide what we're going to do for the next year. So I want you is to understand what your pills are for and why you're taking them. For instance, today I saw a person whose blood pressure was a little bit low, felt a little bit dizzy. He had a bad heart, and we have 4 pillars of therapy. He stopped 2 on his own because he ran out, didn't go for renewals. The third one, well, him and his family doctor decided his blood pressure was too low. Well, you weren't using a medication for blood pressure. It's to make his heart stronger. So once you have a weak heart, we sometimes can make it stronger. Now his heart got strong, now it's got weak again. So, we have to decide how we work together. So please bring your pills all the time, put them in the bag, bring them all. And we have to decide if I'm going to do them or your family doctor is going to do them. I want to take care of you properly. And for me to do that, I need to see you with all your medications. I need to think about them and get them right. You need to think about taking them appropriately. We all make mistakes. I get it. But let's work together on this one. So we'll decide if I should be the person who should do certain medications, your family doctor. But I don't want to I don't want to hear statements, well, the pharmacy will call you. It's not the gas station who calls you when you're out of gas. You want to do them appropriately at the right time, right place when we're having a visit. So when my students call you, make sure you understand, or before you fill out your ocean form, or you find out knowing what you're taking. Understanding if you're on a blister pack makes it a little bit harder to do. I think blister packs are good for people who can't manage their medication. I want to be in charge of my medication. I don't want the pharmacist to make a mistake. I don't want the doctor to make a mistake. And I will work together.